have you ever made a mistake with the patient but didn't tell them? All right, let's answer your questions. So the first question is, have you ever had a patient cry during the session? Yes, it was a week ago, and honestly speaking, it happens a lot. Not because they have pain throughout the session, because they are getting tired of having pain for a long time. Like last week, I had a patient, she was in her 70s and she was struggling with the knee pain, back pain, shoulder pain for past 5-6 years. And she was tired of having pain every single session. And when we start talking about her condition, it was her first session, she started talking about the pain that she has throughout the day, and that was emotional for her. The next question is, do you ever get bored listening to patients talk about their pain? Yes, a few times, but listen to me. One of the most important parts of our job is listening to the patient and gather a lot of information about the things that they are saying throughout the therapy. For example, when the patient is talking about their habits, it's really important for us to understand that. But sometimes some patients, they start talking for a long time, like 10, 15, 20 minutes, and we don't have that much time to spend. So that's why sometimes we get bored when they start talking about their background, but not in general. The next question is, what do you do when someone clearly doesn't follow your advice but keeps complaining? Unfortunately, that is happening a lot these days. I don't know what's going on, but what we try to do is that we try to explain to them why they have this pain, so they shouldn't complain. But I had lots of experience that we start talking with the patient, explain what is going on and what they need to do at home to get better. And the next session we ask them, did you do any of them? They are like, no. And then we ask them, okay, how's your pain condition? Do you have any pain? And they're like, yeah, we have a lot of pain. And that moment that happened a few times that I told them, you are not allowed to complain. You are not supposed to complain right now because you haven't done the things that we ask you to do. So yeah, that happens a lot. Next question is, have you ever diagnosed something serious that the doctors missed? Yes, once. I had a patient like a year ago and she had some knee pain and she came to me and said that she's having this knee pain for a while and she went to the doctor tested and said everything is fine, you have to go to physio and do some therapy. And when I tested her, I did Lachman test and I did some tests for the ACL and the test was positive. And I was a bit curious and I told her that these are the tests for ACL rupture and yours is positive. So it means that you might have this ACL rupture. Can you go check with another doctor to make sure everything's fine with your knee? And she went to another doctor and the doctor asked her to do MRI and the MRI shows that there is ACL rupture too. And she did the operation after that, so yes. The next question is, do you treat people differently if they're famous or rich? First of all, we don't know if they are famous or rich, but it happens a few times that I was throughout the session and when I'm doing the therapy, I try to talk with the patient to get to know them and create that trust and bond with them. And while we are in the therapy, they start telling about their job or what they do. So then we have an idea who they are and what they do. So we get to know them throughout the therapy, so we have no idea when they come to us. So no, there is no difference between any patient, but there is a difference between the patient's attitude. If they have different attitude, then yeah, this is a different therapy, I think, as well. Next question is, what is something patient do that really annoys you, but you never say it? Oh man, there is a lot of things I have to say, but one thing I need to say here is that when we give them an exercise or a move that they need to do at home, because we ask them before we give them any exercise, we ask them if they are willing to do this at home. And when they say yes, then we will give them a 1 or 2 move that takes like 2 minutes to do it at home for getting better. But when we ask them the next session or following sessions that, did you do your exercises? The answer is either no, I didn't have time, or I did, but a few times, not more than that. and they just waste our time and their time as well. The next question is, have you ever fired a patient or refused to treat someone? For past 10 years that I'm working in this area, that happens just once. It was around a year ago that I had a patient. She was quite famous because she was mother-in-law of one of the best surgeons in Berlin, and I had her in our session. And the attitude that she had was really hard. We started therapy really good. I started to know her, and then I started to talk with her. And throughout the therapy, she was trying to act or behave in a way that I felt it's not right, and it was kind of racism. And I started to talk with her and tell her that we don't need to talk about this stuff. That's your therapy session. And when you refer to me from your son-in-law, and you want to have a therapy with me, you have to respect me as well. But she wasn't respectful throughout the therapy. So I had to tell her that, sorry, I cannot continue the therapy. And then I talked with the center and the praxis, and they changed all her appointment to another therapist, and I refused to accept her anymore. So yes, that's happened once in 10 years. So the next question is there any injury you're secretly afraid to treat? No, I don't think so, because it's quite general that we have a lot of different patients. One type of patient that I really like is the patient after the operation, because they are listening to you, they are in a really sensible time, so they listen whatever you say and they will do whatever you want them to do. So I really like those patients, but I'm not afraid of treating anyone. The next question is, what is the one thing you wish every patient knew before coming to therapy? One thing that I really want people to know before they come to therapy is that we try to help them to get better, but they have to do the job by themselves. We cannot do anything if they are not willing to help themselves. So when we ask them to do a move or exercise at home, they should do it by themselves. And the last question is, have you ever made a mistake with a patient but didn't tell them? I did a lot of mistakes with patients, lots, but most of them, like 100% of them, after that I admitted and I told them. I remember vividly, I had a patient when I started doing the therapy in Germany, and she had knee pain, and I pushed her a lot on that session. And the next session I had her, she said, yeah, after the last session, I had some pain and this is stuff. And I understand her, but I didn't know why. And then after a while, when I just try to think what's going on, why she had pain after our session, I realized that I pushed her a lot. So the following session, when I sat with her, I explained to her that, sorry, it was my mistake, I pushed you a lot, and that's why you had pain. So yes, that happens a lot that we make mistake, but most of the time I try to communicate with the patient, because it's easier and it's valuable when they understand that you do mistakes, but you admit your mistakes and you try to get better and you try to help them all the time. Thank you for watching. If you have any questions, please write down in the comment and we will answer in the next video. Thank you for watching, and I will see you in the next one.